My name is Pratap. I'm the CEO and founder of HealthyNet. It's a social enterprise here in Kenya. I also teach here at the Institute of Healthcare Management at Strathmore. I'm one of the researchers at in healthcare. So HealthyNet is a unique take on telemedicine. So we believe that telemedicine can solve a lot of Kenya's or the world's problems in healthcare. So there are very few specialists in Kenya, and even the specialists that we have, most of them are located in Nairobi. So there are very few people outside. So for example, the whole of Turkana County, almost 1 million people, and you have just 2 specialists, one obstetrician and one orthopedic surgeon. So it's not going to be possible to immediately equip the whole of Turkana with specialists that they need. So telemedicine is going to play an important role, but there are 2 main limitations of telemedicine. One is it's very difficult to scale telemedicine to cover large areas of the country. For example, if you have Kenyatta Hospital supporting telemedicine for Turkana, you have only a limited number of specialists in Kenyatta to be able to conduct remote consultations. So it's difficult to scale from Turkana to Garissa or Mandera or any other place. The other challenge with telemedicine is it's very expensive. So people rely on real-time video conferencing. So to be able to conduct a video conference consultation is logistically and financially very expensive. So HealthyNet tackles these fundamental limitations of telemedicine by doing 2 things. So we open up this network of specialists to everyone. Anybody who is qualified anywhere in the world can contribute to healthcare over here. But importantly, each doctor is a volunteer. So we don't pay them any amount. We just ask them to provide 2 hours. Sorry, they volunteer 2 hours per month. And that amount they're happy to give to us without being paid for. So by opening it out to a large network and asking them all to be volunteers, we bring down the costs of telemedicine. And the other thing we do is to make the technology more accessible and cheap. So we don't rely on real-time video conferencing, and we have developed a platform that makes it easy for a nurse in a rural setting to share the data, all the important records of a patient, with the specialist who is remotely based. And those records are really important for the remote specialist to understand the case and actually make a difference. HealthyNet has a slightly different take on the electronic medical records. We digitize patient records for a very specific purpose, that is to have a remote specialist engage on this case. We have 2 specific needs. One is that it needs to be easily and securely accessible by the remote specialist. So all they have to do is click a link in their email. It opens up a secure browser. There's no patient details shared, but they have access to the detailed medical record. What tests were done, what is the blood levels like, what are the reports of the other doctors, what the x-rays, the CT scans, all that are accessible without knowing the patient's full name, without knowing his date of birth, and without knowing where he lives. The other important aspect of this electronic medical record platform is that we don't have to train anybody in using this. So that's a challenge with most electronic medical records, is that when a hospital implements such a system, they have to train all their providers in using this system. So what we have developed is a system that makes it easy for a remote specialist to click on a link and have access to this record, but needs no training to really understand what this case is about. It's a very simple descriptive record that a nurse here in Kenya can upload. They can create a very simple narrative, take an image of the patient, take an image of the x-ray, take an image of the reports, enter in important information, and create a simple web page for this case record. I think health is going to benefit by involving everybody who is interested in delivering and helping healthcare. So whether it's the public sector which has a mandate to deliver healthcare services, and also the private sector who have specialist knowledge and expertise in areas. So right now it seems like a very messy transition from a mainly public sector driven area to a place where the private sector, the faith-based sector, the public sector, everybody is trying to do something in this area. So it seems very messy, but I think especially with devolution, where now healthcare is going to be managed at a much more focal level. So each county is going to manage how healthcare is delivered for that particular county. So while at this point they might lack the expertise to manage healthcare delivery in these counties, but very soon they're going to get those skills. At Strathmore itself, we are training the healthcare leaders in each county in being able to deliver and manage healthcare. So that's one thing that's going to be different, that people at the county level are going to have more skills in managing healthcare. But they can also make the decision as to where they need support from the private sector and from the faith-based sector. So that's going to be a crucial role for the county governments to play, is to manage who is going to deliver what. Should the public sector be involved in delivering healthcare to everyone all the time? Or is there space for engaging the private sector to say, you deliver these services, maybe specialist services, maybe diabetes management programs, maybe increasing the capacity of the public sector in infectious disease management. But the counties can take these ideas of where do we need help specifically, and where can the private sector contribute in the most impactful way.